Hi, Dr. Pam. Hi, Doc. How you doing? Can you hear me?
Testing one, two, three. Testing one, two, three.
Yeah, I can hear you.
Hear me?
Yeah.
Say
How you
something?
How you doing today?
Hmm,
Can you hear me?
One second. Let me see where my headphones are. Testing one, two, three. Testing one, two, three. Hello, hello, hello. How's everybody doing today? Everybody in my group, remember your camera has to be on. This is so much fun. You don't want to miss a minute of it. Come on in. Camera's on. Camera's on. Camera's on. Hello, hello, hello. Hello, hello, hello. If you're new to me, hello, hello. I am Dr. Pam. And our cameras have to be on. It's a very interactive class, and it's just a really great way to ask questions. And also, um, I know that you're paying it all your attention. Let me just, it still seems really low. Testing one, two, three. Testing one, two, three. You hear me pretty well? Say something.
Loud and clear.
Okay.
Yes, we can. I can hear you.
Thank you very
Yes,
much. Thank you. Thank you. Thank you. Thank you. And Carla, if you'll turn your camera back on, yeah, let's get started. So, how's everybody doing today?
pretty
Is
good.
everybody,
Uh,
everybody off tomorrow? You get to do something fun and exciting.
I don't know about exciting, but I am off tomorrow.
I have been officially retired from a brick and mortar for about this is my second full week, and I can't get my life together. I just cannot figure out like right now we're really busy. So tomorrow looks like I start at like 9 and I work till like 9 o'clock tomorrow night. And I can't like figure out my schedule life. I don't know. So I before I worked during the day at the school, so I came home when I worked in the evenings, but I can't figure out my life schedule. So I'm a lot discombobulated, I think. That's the word. Okay, so tonight is really how to answer the questions. I am never a fan of the acronyms. I've never ever been. We get paid to be nosy. It's really that simple. I'm going to say assess, assess, assess before you intervene. Always, always, always. And even when it's a first, next, best question, I'm always thinking, are there any more questions that I can ask them? So many of the questions I think that a lot of people struggle with is the content behind the questions. I hear so many people think if I just know first, next, that but I'm still missing the content. So that's a lot of what I want to make sure that we understand. So let me see, LC's in the room. Who's taking LC? And Carla, You're taking the LM or LC?
I'm taking the CME
I
council.
didn't hear that.
I'm having.
You guys hear her? Do you guys hear her? Then it's me. Okay, hold on. Oh, it's me. My phone got bumped off. Testing 1, 2, 3, 4, testing.
Can you hear me? Can you guys hear me now?
And it's my phone rang and my phone
I think
picked
it's
up the
me.
call. Give me 1 second. I'm trying to figure out what my phone did. My speakers are my Bluetooth. There we go. There we go. Okay, sorry about that. My phone rang and I think my phone picked up my headphones. Okay, so let's try that again. So, okie dokie. So, what I was saying before is really when we look at a lot of the other tutors, a lot of everybody I've heard 1,000 times, the eat pie, eat cake, eat whatever you want to eat, just not a fan of any of those. Never have been. We're just going to remember some of the basic rules of what we learned in social work school. That really is, those are just the rules that we learned. The acronyms are kind of putting those steps in there, but we don't need all those steps. Any of my repeat test takers that are a fan of the acronyms, and tell me how they worked for you.
I like old as Pam loves gold.
That only belongs to Piaget, okay? Oh, that's Freud. I'm sorry, that's Freud. That's my favorite too. So that is definitely. Those of you, or is everybody a repeat test taker? Most often, that's who I get. Yeah.
Yeah,
Yeah.
yes.
Yeah. We're good. That's a good thing. That's a good thing. We can definitely help you with that. Okay. So I put it in the chat box, and that's you can right click it and save it. Remember, so no matter whether it says first or next, I'm really understanding the question first, where we spend more time in the question than we do in the answers. There are recall questions where I just have to know what the answer is, and then there are application questions. But either way, they're giving me hints and clues in the question, but I do have to know what they're asking me. And I do have to know theory. I have to know person-centered, right? When I talk about Carl Rogers said the client is the expert. And I'm looking for questions that I will use those words, but not necessarily even give me his name. So all the theorists we see are always in there. I promise you, Freud is in there all day, every day. Freud says that there's insight. Most of my clients struggle with the intervention pieces, like what do I do now? And many times, still in an assessment, in an intervention question, I'm still many times going to ask questions first. Okay, we get paid to be nosy. So I put it in your chat box and you can right click it to save it. We're going to remember assess, assess, assess before I intervene. Assess can mean a lot of different things. Sometimes refer to the psychiatrist or the psychologist is assess. Okay. Oh, I can't refer on the first time. I don't know where you've heard that. It really just depends on that question. Every question is absolutely different. And most questions that you've seen in some practice material have been questions, of course, that are older test questions or something related to the test. So it really may be very similar, but they're still not the exact same thing. So we're really trying to focus on what the question is asking me. When it comes to my LC, we know that was human development questions. We have to know Freud. We have to, and the oral anal phallic. We have to know human development. We have to know normal human development. When it comes to the diversity, I've got to know the terminology. But what I do first often doesn't change. It's really a matter of knowing who said what. So let's kind of just look at questions in general. I'm going to just share a couple. We'll kind of go around the room and just trying to see how we answer them. It really is just a kind of a group, if you're new with me, where we all just kind of ask questions. I want you to feel extremely comfortable just asking. And also, is there anything you want to ask me? Something you've seen on a different test site, a test page that you're confused about? Feel free to ask. I can usually explain it to you and why that's the answer. Or why it's not the right answer, either way. Tell me in general, what are you using now? Anybody? What are you using to study?
Your videos.
Good answer. What else? Dimitri, before you met me, what were you using to study?
Hi, Dr. Pam. Well, when I did my master's, I used your videos. And I've taken one of your boot camps. So I used it when I did my master's. So I have used your program. I took my test once, my LCSW, and I missed about a couple of points. And I've scheduled to retake it. I probably shouldn't have taken my test that day, but I didn't reschedule it.
Was it a bad day? What was going on that day?
Well, my doctor started me on some Topamax, and I kind of had a little impaired thoughtness, and I had to decrease the dosage, and I probably should have rescheduled. And I had realized at work, and she had told me that could be one of the side effects of my Topamax, and I don't know if that was the problem or not, but I had noticed some problems at work with my thought, and she decreased the dosage, and I probably should have rescheduled my test after I realized it, but I did not, and I missed about a couple points.
Okay.
So
What surprised you about the test? Anything we can go over that surprised you? That like, oh, I didn't know this, or I'd not seen this before?
I don't think anything surprised me. I had a lot of domestic violence questions. I guess I was really shocked to have so many domestic violence questions.
On the stages of domestic violence? Was it on when a client leaves? What is it? What were they about?
A mixture of it all.
Okay.
Just when to leave, what to do. Basically, they coming in, do you, I guess, basically advise them to go back home, or I guess basic safety planning, just basically developing the safety plan. Do you get the children safe, or basically what to do? So I guess basically the stages, so to speak. Just a lot of domestic violence. I was really shocked I had so much domestic violence on the test.
When I see a lot of those questions, I'm going to tell you a lot of those didn't count. When I see the same subject and they're written the exact same content, but written differently, that's called test item difficulty. And I'm trying to decide how I write the question to see how difficult it is. So if everybody misses this, the way I wrote it this way, then we're gonna not use that one. But if everybody got this one right, then we're probably not going to use that one either. So whenever I see lots of those, always answer them the exact same way, but knowing that they're looking to see which ones count and which ones don't. It's called test item difficulty. Okay. But always don't think they're out to get you, and always answer them always the same way. So, just a couple of things when I think about domestic violence. So, in general, a lot of the questions I see is, what is the theory when women decide to leave?
What is the theory?
Uh-huh.
When
Anybody
they do
know?
decide to leave,
Uh-huh.
that the risk has become more than the benefit. The risk has outweighed the benefit, is when they leave.
Absolutely. You know the name of that?
Um,
They're right. It's called the social exchange theory.
yes,
Okay. And
social
that's what,
exchange.
yeah,
I can think of it. Yes.
exactly. And that's what you might see on the test is knowing that theory. And it really may not say that theory's name. And it's
Right.
not just about women leaving domestic violence, but it's the right theory of when a woman decides to leave. It's
Right.
when any of us will leave any relationship, right? We'll stay in any relationship as long as it's good for me. Carla, are you doing the NCE? You're in the wrong group, you know that?
Can you guys hear me now?
Yeah, you know you're in the wrong group.
Oh, that's the one they added me to.
So I did this one yesterday.
Oh, okay.
You are more than welcome to stay. I'm going to do some of the same questions I did yesterday with the NCE, but this one's based on social workers.
Oh, okay.
Okay, but you're
All
more
right.
than welcome to stay. Okay.
Thank you.
So this is the social exchange theory. This is any relationship when I'll leave, whether it's a job, whether it is a friendship, anything. When it costs me too much is when I'll leave. Whether it's a friendship, no matter what it is, when I've had enough, when it flips over, I'm out. Okay, so it's called social exchange, and that's the right answer when women decide to leave a domestic violence relationship. That's always the right answer. One of the other things that we really have to remember with that one is we used to teach women to just get out. Just go, just go, just go. We don't teach women that anymore because we have found that's, and I've been in the field for 30 years. That's exactly what we taught women 20 years ago. Just leave. We know that that's when women die, and I know it's both genders. I am aware of that, but we know that that is when women now die. So we don't teach women just to leave. We talk about a safety plan first, right? And in those questions, also, we're going to remember it's a reading test. If she says she doesn't want to leave, are we going to do anything different? If she says she doesn't want to leave, then that's her choice. That is absolutely her choice. What about children? Can children see domestic violence?
No.
No.
When do I report domestic violence with regards to children?
When they see it or hear it.
When they see it or hear it. Absolutely. Absolutely. If mother chooses to stay and get her butt beat, it's up to her. It's really up to her. Okay. But if children hear it or see it, then we definitely need to report that. But remember, and I know it's hard to believe, but just because they're a lousy spouse doesn't mean they're a lousy parent. Right? For the test, for the test, for the test, for the test. Okay. What about drug and alcohol? I think we see a lot of those, and many times we don't know what to do with those. Yes, no, maybe?
Yes. Yes, we see a lot of those, and it depends. Sometimes we don't know what to do with them.
Okay, so the goal is that we don't treat for the test, but we still assess. But yet there are always questions on there about what withdrawal symptoms look like. Right? How do I know if a person's high? How do I know if they're coming down? But I'm not supposed to treat, so I don't know what do you want me to do? But we'll find there are questions on there of what it looks like. So if I am coming down from or withdrawing from a drug, etc., when is the only time that it's life threatening?
Alcohol withdrawal?
Withdrawing from alcohol.
Alcohol. And it's still not a 911 call. It's letting the person know that they definitely can go into delirium tremens. They can, get those DTs, but it's not 911. It's really, really nice if someone is going through opioid withdrawal. It's nice for us to call to help. It is. But they ain't gonna die. A lot of people go through drug and alcohol withdrawal often in court and in the prison jail system. You're not going to die. You wish you're going to die, but I swear you won't. So it is nice to do that, but it's definitely not necessary. Okay, so let's just kind of look. So a lot of them are just simple kind of what do we do? We're going to start off with some simple ones with our first next and what do we do? Remember, we always assume it's a first question. If it's a best question, there's more than one answer, but we're always assuming the question is, what do I do first, no matter what it says? And I get lots of shoulds mean this and this means that. No, they don't mean anything any different. Every question is something different. And every question, I want to figure out what they're trying to measure to see if I know. That's what matters. Okay, so we always start off with reading the question and always understanding what's happening in the question first. Always, always, always. Okay, I'm going to start right in my middle. Jessica, read this one for me. Read the question first.
Okay. Okay. A therapist is working with a family with a strict religious Orthodox belief and a 14-year-old boy who is showing problems, behaviors that contradict his parents' belief. The therapist believes the teenager's actions are developmentally appropriate. What is the best course of action?
Okay, so stay in my question. Tell me about it.
So you're working with a religious Orthodox family. There's a 14-year-old boy who is, his behaviors are age appropriate, but they contradict the faith that the family follows.
Okay. So now the question is, what is the best course of action? Okay, so let's read all four first.
Assist the youth in seeing how her behaviors are against the family's values. Schedule a family session in which the family can discuss the differences in the youth's belief and the parent's belief. Normalize the youth's behavior and validate her feelings while identifying problematic behaviors in the context of the family value system. Educate the family with the youth's behavior are normal.
Okay, so let's rule out what's no way, no how, the best answer.
Okay. I would say a rule out would be A, assist the youth in seeing how her behaviors are against the family values.
Okay.
Can you go down?
Oh, I'm sorry. I am so sorry. I didn't have to mean to do that. I did not mean to do that. Let me also put it in the chat box so you can see it there as well.
Okay. Tough though, because they all I want to provide psychoeducation here, but
it doesn't give me a lot, does it?
No, it doesn't.
I hate it when they don't give me a lot. Like, what am I supposed to do? Give me some more information, but this is all I got. So I got to figure out what I'm supposed to do. What else am I going to take out?
Maybe B, schedule a family session in which the family can discuss the difference between the youth's beliefs and the parents' beliefs.
What's the problem? What's the presenting problem in the question?
Her behaviors and going against the religious norm.
Okay,
but they're age appropriate.
Got it. So now I'm down to 2. I'm going back to the question. I'm trying to figure out, again, based on... So what is my best answer?
I'm stuck between C and D. Um, because I do want to validate her feelings, but I also want to identify the problematic behaviors in the context of the family value system.
Okay.
D is like providing psychoeducation that, yes, these may be problematic behaviors to the faith. However, they are age appropriate.
We're going back to the question. Which one answers the question?
I would say C.
And what words in the question prove it to me?
The problem behaviors contradict the family beliefs. So that's providing the like we're validating the feelings, but we're also like letting her know that this may be problematic behavior within the faith.
Very good. So while D is something I might do, C is just the better one because when I go back to the question, her behavior, which may be normal by my belief system, does my belief system matter?
No.
Not at all. What matters is the family's belief system. And obviously, this is a problem for the family. Okay. So everybody see how I got there? Was that pretty simple?
No. But
Okay.
I'm excited that I
Process.
got
Let's
it
talk
right.
to me. Okay. Okay. Let's talk about it though. So tell me what.
I think the problem sometimes with these tests and the questions is when you've been doing this work for a long time, you're
Mhm.
automatically going to go to what you would do as a therapist or somebody providing psychoeducation. But it's a
Mhm.
reading comprehension test, much like the first one. And so connecting the answer to the question is more essential than what I would do in practice. I just need to answer the question and only the question.
Exactly. And go back to the question. How do I know what words in the question prove it to me? So stay in the question. And I think that's definitely all of us. The more experience we have, the harder the test is. But if we stay in the question, go back to the question, what's it asking me? That is definitely the skill to learn. So we don't ever make better social workers. We just make better test takers. Now I've got to stay in the question and based on what this question, and every question is different. I may see something very similar to this next a couple of minutes from now, but that's not exactly the same question. So I got to figure out what they're asking me. Okay. Say Demetra just walked away. Konik, how are you today?
I'm doing pretty good. How
Take
you
this one for
doing?
me. I'm good. I'm good.
Okay. An agency therapist is experiencing difficulty concentrating and completing work-related tasks after the recent death of a parent. A colleague reports to the therapist that patients are complaining about the therapist's lack of attention and follow through. The therapist should. So, what's going on is we have a therapist that works in an agency that just lost a parent, and their colleague came to them about patients' complaints about the therapist lacking attention and follow through when meeting with them. We have A, take personal leave immediately. B, ask the colleague to address the issue with the patients. C, appropriately disclose the loss to patients. D, seek consultation immediately.
Okay, so tell me again, what's my role in this one?
It's a therapist who lost a parent and is not following through and is not paying attention to their clients.
Okay, a colleague comes to the therapist because that's what I'm supposed to do, right?
Yes.
Okay, if I've got a problem with somebody, I go to the person first. Okay, so now,
The therapist should. What should the therapist do? I'm going to rule out B, ask the colleague to address the issue with the patients. And I'm going to rule out C.
okay,
And now I have A and D. Uh,
I'm going back to the question.
yes.
Okay, so an agency colleague is reporting experiencing difficulty concentrating and completing work tasks after the recent death of a parent. A colleague reports to the therapist that that your clients are complaining that you're not there. So, as the therapist, what should I do first?
What should I do first? I'm going to go with D.
Tell me why.
I'm going to go with D because necessarily taking a personal leave immediately won't help me follow through or pay attention to my patients
So, why am I going to do D?
because it's the next thing to do.
So, what am I experiencing?
Transference.
Not transference, but my stuff is in the way. My feelings are in the way. Whatever happened in my life is spilling over into my clients. That's countertransference.
Countertransference.
My stuff is spilling over into the client's world. Is it not?
Yes, it is.
Whenever my stuff spills over to the client's world, I always seek supervision. Always, always, always. Okay. When my feelings are in the way, my stuff gets in the way, I seek supervision. Okay. There are very, very few times that I seek supervision. And this is consultation that makes it an LC question because LCs don't need a supervision. But when I see a question, when I see that my stuff is the problem, I always seek supervision. Make sense?
Yes.
It's really a lot easier when it says to me that it's countertransference, but it doesn't always
Right.
say that, does it? And I also know there are very few times that I seek supervision. I'm the very best. I don't need anybody to tell me what to do, but my stuff got in the way. Okay. Cassandra, you see this? You know it's recorded, right? And everything, you get everything and watch this video 15 times, right? It's all yours, I swear.
Oh, yeah. It's just
Okay. So you have it forever to take notes. Enjoy the moment.
okay. I just wanted it to register. But yeah, okay. 33, right?
Mm-hmm.
Okay. A essential part of the work done in group consists of challenging and exploring beliefs about situations. This component, including explaining, clarifying, interpreting, providing the cognitive framework needed for change, formulating ideas, and making new decisions. Which of the following does this best describe?
Okay. So stay on my question first. We're understanding the question always.
Okay. Um, so it's talking about essential part of work done in groups, consists of challenging and exploring beliefs and situations. And then it's going over what happens in the group, which is explaining, clarifying, interpreting, and providing the cognitive framework needed to change, help formulate.
If this were school, you just got caught in the plagiarism app because all you did was tell me exactly what it already said. I need you to paraphrase.
Okay. So I mean, I'm trying to, when I was reading it too, I wasn't really grasping it.
Okay. And that's really okay. That's really okay. That's why we want to spend so much more time in the question. That's exactly what we want to do. Understand what it's asking me. Okay. So go ahead. Just stay there. It's okay.
What it's basically asking me is what, I believe what it's asking me is what best describes the work that's done in groups?
Okay. But it gives me those other words, right? So what are the terms it gives me are what? So it's saying, right? So what I'm doing is I'm challenging and exploring their beliefs about the situation, right?
Okay.
So your thoughts and about whatever happened. I can do it by clarifying, understanding, maybe interpreting, having you see it a different light. I'm providing a cognitive framework. So cognitions are how we think about it. Okay. Helping you make new decisions. So which of the following does this describe? So it's you now let's go from there and you tell me what we're going to go do next.
Okay. Which of the following does this best describe? Self-disclosure, termination, cognitive restructuring, and trust. I'm going to rule out termination.
Okay. I don't see enough in there to support that.
Yeah. My computer is like messed up, so I can only see half the question, but that's part of the problem for me.
Is it our faces in front of you and it's also in the chat box? I can move it, make it bigger. How can I help you?
I just need it moved over because like part of my computer is messed up, but I can make it big, but I can't make it big for whatever reason.
So tell me which you may make it if I put it in the center, will that help?
I got it. I
You
just
sure? Okay.
Yeah.
Okay.
Okay. Okay. Self-disclosure gonna rule out?
Okay. I don't see that in the question, do I?
Mm-mm.
So now I'm between C and D, and I'm going back to the question, trying to figure out what they're asking me.
I would also rule out trust.
Okay. So are you telling me this is a theory question? What theory would the cognitive restructuring be?
CBT?
Absolutely. So it tells me in the question, I'm challenging your thoughts. CBT says you got stinking thinking. It's the triad. If I change the way you think, I'll change the way that you feel and the way you behave. So CBT says the problem is you've got stinking thinking. So if we look at those cognitive errors, we talk about overgeneralization, magnification, making a magnet out of a mountain out of a molehill. Right? So there's a whole list of cognitive distortions that CBT is made to fix. That's on both my tests. So Socratic questioning or proving the evidence, that's a Beck question. And Beck says the problem is you've got stinking thinking. He said that depression isn't even real. The problem is the way that you think about it. And remember, DBT is the opposite. It came in later and says the problem is the way you behave. So Marsha Linehan said if you change your behavior, then we'll change the way that you think. And hers was behavior first. Okay, so those are all the words that belong to CBT. And the goal is to change your thinking pattern. Okay, good job. Good job. This one's a longer one. So put it in the chat box as well. Okay. Shawana, LM or LC?
LM.
Okay. Won't change this question.
Okay. You are referred a new client who is a well-known singer in a rock band. He appears restless and uncomfortable. He comes into your office wearing mirrored sunglasses and he leaves them as he begins talking to you. This makes you uneasy since you cannot see his eyes and you see your own face reflected in his glasses. He then puts his boots up on the edge of your leather couch and lights a cigarette. You've never allowed smoking in your office and you do not have an ashtray. If you are a humanistic extensional therapist, you will most likely
what the hell? That question even asked me. Okay, we're always going to stay in the question first. Okay, what's going on? Okay.
So the client, the social workers refer a client who's a superstar. Basically, he comes in and he's restless and he appears restless and uncomfortable, but he's wearing glasses. He's making the social worker kind of feel uneasy. She can't make eye contact with him. He puts his boots up on the couch, lights a cigarette, and the social worker doesn't even allow smoking in her office and don't even have an ashtray.
This man think he a superstar. He may be a superstar, but he came in my law office. Okay. He's got his sunglasses on. He sits in my chair. He puts his feet up on my desk and he's smoking a cigarette. Okay. So we're clear. Now it says I'm a humanistic existential theorist. Humanists are people that put people first. Okay. So then Carl Rogers, Maslow, Virginia Satir. When I think about humanists in that category, those are the kind of people that the therapists that put people first. So Carl Rogers, right? Person-centered. Maslow, my hierarchy of needs, and as well as in Satir, who talks about family and she talks about the roles in a family group. Do those names sound familiar?
Yes.
Okay. So now that's where the theory I'm coming from. So then what would I do? And remember, I'm still thinking, what would I do first? Okay. Read all four.
A, buy an ashtray and set it by the couch for the next session. B, immediately acknowledge his discomfort and your uneasiness. C, tell him you do not want him to wear mirrored sunglasses or to smoke in session, but do not comment on his discomfort. D, make him feel comfortable by asking for a smoke and putting your shoes on the couch. Oh, God.
Okay.
This is a lot.
I swear I love a lot. I got so much to pick from. When there's only a little in there, I get lost. I love it when there's a lot.
Okay, so I'm gonna rule out A, buy an ashtray and set it by the couch, because I don't even allow smoking in my office.
Okay. And again, he's sitting right in front of me. I'm not going to do anything and just buy an ashtray for next time. So that's definitely not what I'm going to do first.
Okay. I'm gonna rule out D, making him feel comfortable by asking for a smoke.
That established rapport, won't it? So now between B and C, when I get down to B and C, I'm going back to the question.
Okay.
Okay. I'm remembering the steps of social work. So between B and C, right? Where are we? Have I known him for a while?
He's new.
It's our first session, right?
Right.
Does it say that? I'm referring to new client. It's our first session.
Okay.
Okay, so now.
I'm gonna rule out C, and I'm gonna pick B. I don't know.
Okay, I'm going to tell you either way. You have to go back to my question and prove it to me. What words in the question prove B to be the right answer? Read it out loud. Read it out loud. We're going back to the question.
So read the whole question. What am I reading?
Until you figure out how you got to prove it to me in the question. This is how, here's what happens is we get to the test, we get down to 2 and we walk away. The piece that most of you are missing are prove it to me. If you're right, and I've already told you you're right, what words in the question prove it to me?
Because I'm a humanistic
Nope, not good enough.
Okay.
I'm just going to tell you to read the first line.
Oh, I didn't even go that far up.
Read the first line out loud.
You're referred to a new client who is a well-known singer in the rock band. He appears restless and uncomfortable.
Stop right there. When there are feelings in the question, what do I do with the answer?
Oh,
always acknowledge the feelings. If there's feelings in the question, there are feelings in the answer, and feelings outweigh assess.
Yes. Okay.
I know there's lots of other stuff in here, but what I wanted you to pick up on and how we knew it is the right answer is because no matter how he's acting, the question says he appears to look restless and uncomfortable. So he came in like a badass sitting in his seat on but he's really uncomfortable. Do we see how, if we go back to the question, that keeps us from missing it? And feelings outweigh assess, right? So my little assess. But if I can't assess because feelings or safety are in the way, I go back and I address feelings first.
Okay, let me ask you, this what kind of threw me off a little bit because I was in my studying was told to always read like the last question first.
How well is that working for you?
No.
That's all I got to tell you. If it's working, then don't believe me. You do you, boo. I'm good. If it's working for you, stick with what you're doing and bye-bye. It's been fun. Okay. But if it's not working, let's try something else.
I didn't even go that far back up, but you're right.
So, okay. Every word matters. And I hear lots of people all the time that say there are distractors in the question. I disagree with that. This is like a scripture. When the scripture tells you something, it means something. The woman at the well, she didn't have a name. It mattered because it didn't matter her name. It meant, if you know scripture, it meant that she was not a Jew and Jesus was a Jew and Jesus was talking to someone that wasn't a Jew. She didn't have a name because it didn't matter. What mattered was the other part of scripture. So I always say it's like the Bible. When they go out of their way to put that in there for you, those are hints and clues. Everybody takes the same test. Everybody's got to read the same hints and clues to get the same thing. Does that make sense?
Yes.
And again, if it's working for you, keep doing what you're doing. Okay. But if it ain't, just saying, let's try something a little different.
Right.
Okay. And I do understand that. I do. But I'm going to say it's a reading test. I'm always going to say it's a reading test. We're always going to spend much more time in the question than in the answer because I really want to know what are they want me to do. Okay?
Okay.
Anybody else want to process that? I will say to you in general, feelings trump assessment. That is true. But I still want you to go back to the question to prove it to me. That way, when I get down to 2, I can prove it. Yeah, okay. There's only 3 on this one. Okie dokie. Where'd I go next? Dimitri, you ready?
Yes, ma'am.
I know there are a lot of words. I swear I know. We'll do some one-lined, but I want to teach you how to understand and decipher the questions, okay? So tell me what's going on.
Okay. Linda is overwhelmed with trying to help her 16-year-old son, Carter, with his addiction to heroin. Carter's father died a few years ago from the same addiction. Carter is involved in the court system after getting caught with possession at his school, has frequent court dates, and is currently in an intensive outpatient rehab. He has overdosed once and spent some time in the hospital and seems to be in a vicious cycle of improvements then decline. Linda feels helpless and overwhelmed with this situation and is at risk of losing her job due to needing to leave at a moment's notice to deal with his issues, most oftentimes related to Carter. What should the therapist do first in helping offer Linda support? So,
Whoa, Lord. What's happening in this question? Woo!
Linda. So Linda is overwhelmed. She's got a 16-year-old son who has an addiction to heroin, and his father died with same addiction. And he's had some trouble with the court system. He's gotten possession of heroin at school. He's been in court. He's been in rehab, outpatient. He's overdosed. He's been in the hospital. And apparently he's had some improvements in the rehab where he's done better and then he's declined. And then Linda feels helpless and she's overwhelmed with the entire situation. She's about to lose her job because she's having to miss work, dealing with situations with Carter. So the question is saying, what should the therapist do first in helping offer Linda support? So the answer choices are offer to collaborate with other services in Carter's life to build a continuity of care for him.
I think this one is explore trauma regarding Carter's father. I think that part is left out.
Okay.
Okay, sorry about that. Okay.
Help to
No, sorry. Go away.
Help to identify and build Linda's support system that also includes therapeutic services. And C, explore trauma regarding Carter's father. So what would we rule out? I think we would rule out C, because
Okay.
that's
And
just
now I'm between A and B. And which one best answers the question of what we're going through right now?
Offer to collaborate with other services in Carter's life to build a continuity of care for him. Help identify build a support system. I would rule out A and I would go with B.
Prove it to me.
Well, first it said, what should the therapist do first in helping offer Linda support? And I think
what words in the question? The whole question tells me that that's the best answer. How do I know that's the best answer?
Because it says she's helpless and overwhelmed and about to lose her job, and at a moment's notice, she just can't deal with the issues that are related to Carter.
Absolutely. And in the beginning, it even says she feels overwhelmed. So even there, she feels overwhelmed, okay? So then, if she's feeling overwhelmed, let's look at what other support system we can help her to get through this because she is overwhelmed. So that still was really her feelings and help her identify and build a support system because she feels helpless and overwhelmed with the situation. Everybody see that? How we got there? Easy, right?
Yes, if the test just be this easy.
Test is just heck, it's hard. It is so hard, but it's doable. It is so doable. We just have to know the rules and what to look for. But it is hard. Let's not pretend it is hard. Okay, let's see. Where am I at? Gloria, you ready?
Sure. A client reports sexual advances by a former therapist. You should. A client reports sexual advances by a former therapist. You should reassure the client it's not typical behavior, recommend reporting to the ethics committee, Inform the client of their options in this situation. Reassure that no one else will hear about it. Okay, so I'm gonna rule out D.
I can never reassure anything. I can tell her that what's said in this room is confidential. But reassure always scares me whenever I see that in a question. Like, oh, it's like, I can never promise you a rose garden. But old enough to know that song, go to bed. You're past your bedtime.
So with that said, I'm gonna take A out as well.
Okay. That is true though, is it? I hope that's not typical behavior. I'm not sure how that would help my client though, but it's true. I really hope most therapists don't go around picking up their clients. Okay.
Yeah.
So now you're between B and C. Which one of those things would I do first?
I think I'd first do C because that might help the client.
Can I tell? Can I call up the other therapist? Can I report the
No.
board? Can I do anything?
No.
Why not?
Because this person's not in danger.
Ding, ding, ding. No one's in imminent danger. No one at all. And I know it might be hard to be believed, but clients lie. Clients lie. They lie. They lie. So I'm going to tell her, these are your options, right? You can definitely go back to him. You can report it. You can go to his supervisor. You can call the police if it's illegal in your state. But I can't do anything.
Right.
No one's in imminent danger. That is confidential information. If D said, remind her of the rules of confidentiality, that would have been a different answer. Right? But reassure that no one else will hear about it.
Right.
You know? Okay. But no one is in imminent danger. So I definitely cannot report that. Good, good. Good. Stay with me, Gloria. You get another one.
Okay. Yeah, I'm gonna wait to make okay, there you go. Which combination of interventions is best for Gabriel, a veteran with anxiety, nightmares, and difficulty readjusting?
So when I see questions like this, guys, I really have to put them in order of what's going on. Okay. So he's got anxiety, he's got nightmares, and he's got difficulty readjusting. And I also know he's a veteran. So I have to diagnose him in that one line and then decide how to treat him in the appropriate order. Do we see that? This is definitely an LC question. My LMs, you might not see anything quite this difficult, but it's still very common to know that I have to diagnose and then intervene. So that's where and you tell me if I'm wrong, that most of my clients really struggle with the intervention. Like, how do I treat? And this is where we struggle. So we have to figure out in this one line, what's the diagnosis and what do I do? Okay, go ahead.
So which combination of interventions is best for Gabriel? A veteran with anxiety, nightmares, and difficulty readjusting. EMDR, psychiatric referral for meds, veterans program for support and readjusting counseling. Psychiatric referral support group for wounded soldiers, newborn care classes. Exposure therapy, psychiatric referral, veterans program, and EMDR veterans program newborn care classes.
Anything I can rule out?
B and D.
I ain't seen nothing but he got no baby.
No.
Right? There ain't nothing in that question. Ain't nothing nowhere to say he got a baby. Okay. Yeah. So exactly. Okay. So we're going to start off with the obvious. Okay. So now I'm between A and C. Okay. So we're going to assume he has PTSD.
Yes.
We are, because we know that nightmares are definitely a sign of PTSD. Remember, acute stress disorder is 3 days to 30 days. Okay. But there's no time frame here. But I know it is a veteran and nightmares. So that definitely says PTSD, red, big old red flags, PTSD. Everybody see that in the question, right? We get that?
Yeah.
Okay. So now I'm between A and C. How do I treat him?
Exposure therapy. Exposure therapy to what? EMDR, psychiatric referral from medicine. I'm going to go with A because
You are.
EMDR, I'm not.
Yes, you are. You are. You
Oh,
are.
I'm like, I'm not. EMDR is helpful for PTSD because
That's
it's
the
based on trauma.
treatment. Always. That's the right answer of how we treat that. Okay. Exposure therapy is most often what we do with what's I'm looking for? Systematic desensitization. When you have a irrational fear, right? You're afraid of spiders or snakes. We slowly desensitize you to that. That's more of exposure therapy. EMDR is always the treatment for PTSD. Okay. You might see a test question because one of the clues of understanding this is most of our soldiers don't get treated right away. If I get raped or something awful happens in a couple of days ago and I get treated right away, most often I won't get PTSD. I've got acute stress disorder. Actually, even before that, this is not a test question, but just FYI. The first 2 days, the first 24 hours, it's called acute emotional reaction. So acute stress disorder happens on the 3rd day, right? If I get treated between 3 days and 30 days, I never get to PTSD. The problem with people in the military is we often don't get treated until we get out. And we've seen all of this trauma for years and years and years, and we didn't get to discuss it until we get out. So when I see a veteran, I'm almost always sure they have PTSD. It's not acute because they don't get treated right away. And EMDR is the treatment for PTSD. Okay. My LCs, do these questions feel similar? Do they feel like I've never seen this stuff before, Dr. Pam? You're just making it up. Talk to me. I go off what you tell me is on the exam.
I definitely haven't seen these in the L exam. But they're definitely things that I have come across in like reading literature for the C.
Okay.
So they're not in the BSW APGAR book or the L, but they're definitely questions like this in the LC APGAR book.
Okay. And on the test, remember at my LC level, you're diagnosing and treating. Okay. And so again, I didn't say first because this was total intervention. Okay. But I do need to know how I treat. How we doing? Yes. We feeling okay. This is like, these are hard, Dr. Pam. These are hard. These are hard. I know. Gloria, do you recall seeing questions about PTSD and EMDR?
I do remember seeing EMDR.
Okay. So EMDR is the rapid eye movement, if you're not sure how that works. The goal is to desensitize the fear. You have the client, anybody trained before I even pretend to describe it? You want to describe it then, since we are clinically trained?
Me?
Yeah.
Yeah. Okay. So EMDR, that's eye movement. So sometimes you'll start bringing up the trauma or the triggering event, and then you'll ask the client to kind of like, depending on what type of modality, like what type of instrument you're using, because sometimes you can use like little paddles, or you can use like waves, or you could even use your hands, and that's supposed to kind of like help them, I guess, like live the moment, but then be able to kind of like walk through it and kind of discuss the feelings that arise when the memory is triggered.
My understanding is the goal is to kind of trick your brain that you cannot focus on the pain while doing your eyes or focusing on anything. So I'm trying to desensitize like all of this pain while my body is doing something else because my brain just can't do both. It just can't do both. So that's the goal, is to kind of trick my body into understanding this ain't gonna work for us. We got to figure out something different. Okay, dokie. I'm going to go back to Dimitri. Okay.
Which situation least requires psychiatric medication evaluation? Okay, so which one of these requires the least psychiatric medication evaluation? Mixed state mania plus depression.
Stay in my question. What's it asking me?
Which of the following below would you not treat with psychiatric medication? You would not send for a psychiatric medication evaluation.
Got it. Okay. So when I look at these, when I read all four, I'm going to look at, when it's a not question, I look at the ones I would do first, right? Which of these most definitely always the recommended treatment is meds. Okay.
Right.
So now let's read all four.
Mixed state mania and depression, persistent depressive disorder, a parent taking child's ADHD medication, and obsessive unwanted thoughts and behaviors. So we can rule out A.
Okay. Bipolar, that's bipolar, right? Bipolar 1 is how long?
Bipolar 1 is 4 days. Bipolar 1, okay, that's that's hospitalization. Bipolar 1 would be 5 full days of mania.
Or more. It can be weeks of mania. It's full-blown crazy. Okay, absolutely. What is our treatment for bipolar 1?
Lithium.
Now, I have seen on the substance abuse test specifically that I have seen, they finally let you know it's Tegretol. Okay, so remember, lithium, we really don't use lithium anymore. I don't know that the LC is caught up with that. I've been teaching this for years on the LC, but Tegretol or any other anti-seizure is how we really treat it now. So if you don't see lithium, woo! Finally, the test caught up with the real world. Okay, so Tegretol into the exactly. Okay,
would you see Depakote as a potential
you would. I have not seen it on the LCS. I saw it. I've seen it on the master's level chemical dependency test. So they finally switched over, but we've been teaching this for like 10 years, and the LC has not picked up on it yet. But if you
haven't seen like Tegretol or Depakote as a potential answer.
That's what we do in the real world. It is. I know the test hasn't caught up, but just be aware if lithium's not there, we're good, right? Okay, so then bipolar 1 is at least, so remember, major depression is 2 weeks. It starts off with major depression. All of a sudden, they put me on a medication, an SSRI. Usually my behavior improves, and then it's off the chain for at least 7 days. More than that, that's bipolar 1. Okay, I go up, I come back down. I go up, I come back down. Bipolar 2, 4 days or less. People may not notice, and I never, ever have to have a full-blown depression again. Okay, so now what else would I rule out?
Obsessive unwanted thoughts and behaviors.
Ding, ding, ding. OCD versus OCPD. What's the difference?
One is a personality that is basically engraved in us and how we are. And then one is impulsive. One is impulsive,
Oh,
and
it's
then
not impulsive, it's obsessive. Okay, so
obsessive.
that's the word you're looking for. So the thoughts won't stop. Remember with OCPD, which many of you are, you're my perfectionist. You just want life to be perfect. If you got a B minus on a test, you went to the teacher and you beg, how can I get an A? I got to have a 4.0 because I just have to be perfect. OCPD, personality disorder, you've been that way much of your life. You don't think you have a problem. Your spouse wants to kill you, but you're fine. You think you're fine, right? OCD, ego dystonic. You don't like the way it feels, so you'll seek treatment, right? The obsessions are the thoughts. They just won't go away. There's germs on my hands. Can't you say there are germs? There are germs. Oh my God, I'm going to die. The obsessions, thoughts, then the compulsions are the need to wash your hands, right? Because that's supposed to relieve the obsessions. It is ego dystonic. It gets worse with stress. OCPD doesn't change, and you definitely need a medication for that. So now you're between B and C. Oh my Lord, what do I do now?
That's a very good question. Persistent depressive disorder is 2 years,
And
and
adults.
in adults, 1 year in children,
Mm-hmm.
and I don't think we would just really send them for medical evaluation. But a parent taking a child's ADHD meds is probably trying to get a that they stimulation. They're trying to get that work. The medication works in the reverse, so that kind of got me.
I think you
thinking.
brought in some. I think you brought in some personal judgment there.
Well, I'm trying to figure this one out. This one really got
Hold
me.
Hold on. There must be something wrong with that mama because she's taking this kid's meds, right?
Right, that's what I'm thinking, and
what if mama just has undiagnosed ADD and the meds work for her? She just needs to get her own little script.
That's very possible.
So you brought in judgment. You know there's something wrong with that woman. She's stealing that kid's meds. There must be something wrong with her. You brought in some personal judgment in that one.
Yeah, I did, because they do it I see it every day.
Oh, you saw your name on the test. You saw your agency. Did y'all see her? Did y'all see her address, her social security number? Did y'all see that? According to whatever agency works at, and then 412, 51, ever. No, we don't care what you see every day. Everybody takes the same test. And we're going to assume that mama just needs her own meds.
Well, we're gonna make so we're gonna assume
that mama needs to see her own doctor to get her own meds because mom is self-medicating because mom is probably attention deficit and she just hasn't sought medication. So the best answer is B.
Will be persistent. Yeah. Well, so I was, I'm thinking persistent.
Yes, we do, right?
Well, we do, but I'm thinking 2 years. I mean, it's kind of a long-term depression. Yes, I was thinking they would be the least, but then that, I'm trying to probably put too much thought into the person taking ADHD.
You brought all your personal stuff in my test. You did. I don't think you look like them people that wrote the test. I'm gonna put that out there, okay? Because we talk about them people that came over on the Mayflower. Just so you know, okay. I don't think that you look like the people that wrote my theories. Okay, you came up on a different slave ship.
I don't, and that's why I hate questions like that because that's where I feel like sometimes they really. I know they tell you not to think, but they put them there and they make you. Why would you?
But
put
they
a question
don't.
There,
they
taking
don't.
A child ADHD meds.
Because everybody takes the same test. And I need you to realize that whether I graduated from school yesterday, or I've been in the field 20 years, or I went to Fordham or the best Ivy League school, we take the exact same test. And you brought your experience into this. And that won't help you on the test. It makes you an excellent social worker. But remember, I don't make you a better social worker. I make you a better test taker. Because the test doesn't care what you know or what you think you know. And that's the hat you always have to wear. What did the writers want me to answer? And for all of you, you have to leave your thinking hat at home. Everything that makes you so good, leave at home. This is whether or not you know how to take a standardized test. I know the minute you pass, right, you're better social workers, right? The minute you pass, like the heavens open up and suddenly you're a better social worker.
No.
Being a good social worker comes with good supervision and experience, not this test. But you've got to learn how to play the game for the test. And I really hope when you pass, you get on the other side and you teach it. You change it. But on this side, my job is to teach you what the test wants you to answer. That simple. Okay? Okay, dokie. Guanik, are you ready?
So glad I got this one because couples be wearing me out. Okay. You teach a couples communication class. During the class, you demonstrate modes of communication that don't work well and help participants find alternative ways to communicate. In one session, you ask participants to demonstrate an I message. Which of the following I messages is really a disguise you message? I'm going to read this again. You teach a couples communication class. During the class, you demonstrate modes of communication that don't work well and help participants find alternative ways to communicate. In one session, you ask participants to demonstrate an I message. Okay, I am a therapist who teaches a couples communication class. In one of the classes, I've demonstrated some communication that doesn't work well, and I want them to tell me I statements about how it doesn't work. Which of the following I messages is really a disguise you message? A, I cannot be comfortable.
No, we don't go there first. We say in my question. What the hell's an I message?
Girl, I don't know. That's why I'm
how you gonna answer the question? I don't understand. Dr. Pam, I don't know why I failed the test. I don't know why I failed the test, Dr. Pam, because I don't know some stuff. Let's just own some stuff we don't know, okay? It's okay. I messages are really something all of us should know. I, instead of you, that man comes home late from work and you make this big old dinner. You went out, you got the good steak, right? Dinner's all ready, got a baked potato, it's all beautiful. And he comes home late. You all up in his stuff. You should have called me. You were not here. Those are you statements, and your partner gets defensive. Whoa, right? I statements are I feel when you behave. How I feel when you behave. Got it? I am upset when you don't call me and tell me you're going to be late. You married?
Divorced.
I'm sorry. I got none to help you. I got none to help you. I taught couples, married, all that stuff before I got even married, and I got nothing to tell you. I can't maintain more than a night. Okay. But honestly, so when I work with couples and anybody in general, so communication skills are I statements. I feel when you behave. My feelings when you behave this way. This is usually on both of my tests. Have we seen this before?
I don't remember seeing it, but I know it was some couple stuff.
We've never seen this before, ever, my social workers. I just
I've
made it
seen
up
it
5 minutes ago.
not worded like this, but I've seen it. Yeah.
Okay. I statements are usually on the test. On my LM and my LC, that's an intervention of how we teach clients to communicate with each other. It doesn't belong to anyone in particular. Gestalt use it a lot, but they're just I statement. Okay. So then the question says, which of these is really not an iMessage? Okay, so it's a not question. So when I'm reading all four, I'm going to figure out the three that really are iMessages. And one of them, and somebody messed up on how you communicate. One of them is really a you message. Okay, let's read all four.
I cannot be comfortable when someone is climbing all over me. I'm unhappy when my clean house gets dirty. I feel very strongly that you are neglecting your chores. I'm upset about dirty clothes on the floor.
Okay, so we're looking at the ones that are definitely true.
B and D.
Okay. I upset. I feel, right? Pure behavior.
Mhm.
So D is definitely, I feel upset about dirty clothes on the floor. What you did. C, you said B or C? Which one? I'm sorry.
B.
B. Okay. I am unhappy when my house gets dirty. Very good. Now between A and C.
Okay. I cannot be comfortable when someone is climbing all over me. C, I feel very strongly that you are neglecting your chores.
One is the right answer. Which one is the right answer?
The right answer is C.
Very good. Okay. So I still turned it into a you statement, and my partner gets extremely defensive. So definitely on my LC and my LM, I can't be for sure, but on my LC, you're going to see the Gottman method, the four horsemen, the downfall of a marriage. Do we know that theory? That theory?
Very little.
Okay. And that's all I really need to know is very little, actually. But remember that you may not see the Gottman name. You just may see something about the horseman. But that's an expectation that we know. And I wish I could recall on the LM. And I just don't know if anybody's ever told me that specifically. I try to interview my people so I know, and I just don't know. I don't recall, actually. I didn't take notes. So these are the four horsemen. It is Gottman. They're couples that do couples therapy. Bibliotherapy is learning how to telling your client to read a book. Okay. I'm old. Back in the day, we used to use men are from Mars, women are from Venus. Go back and read that book. That's how old I am. We also used love languages. Remember that one? We had to go home and work on your love language. The current bibliotherapy we use is Gottman. They're the apocalypse, the four horsemen, the downfall of a marriage. Criticism, contempt, defensiveness, and stonewalling. Those are the things that make a marriage fall apart. So instead of criticizing my partner, what I should do is have a gentle startup. So we know instead of just saying, you rotten piece of whatever, I could say, well, I love you, but, or next time, something nice first. My contempt is my favorite thing ever while I'm single. Not only did you forgot to take out the trash, but your mama can't cook. Right? I'm taking that knife and just digging it deep in there. Right? Okay, that's contempt. There's no need for that. That's bringing up stuff that ain't got nothing to do with what we're fighting about right now. We know that go back. Defensiveness, it wasn't me. I know what you're talking about. It's only you and I in the house and toilet seats left up. It wasn't me. Who you think it was? So instead of being defensive, you take responsibility. And stonewallings, we just don't want to talk about it. I ain't talking about it. Instead of doing that, learn how to self-soothe so when we go back, we can talk about it. So this is, it's Gottman, the Four Horsemen, the apocalypse or the downfall of a marriage. It is definitely on my LC. Again, you might not have recognized the name. It might not have said according to the theorist, but the understanding the theory, it's on the test. Okay, that is definitely one of those interventions that we teach and that you need to know. Okay. Okay, so that was where I was going there. Okay. Again, when I'm going over questions, does the content feel similar? Have you seen questions, again, where it wasn't so clear, because that's part of all the test questions. If it just said, according to this theory, I'd get it, but it doesn't always say that. They're vague, but they're still there. Yes, yes, Dr. Pam, this makes sense. Dr. Pam, you just made it up yesterday. I do so much better with feedback, and I live with 2 dogs. You know that, right?
It makes sense.
Cassandra, we're going to diagnose.
You said in this question, do this question.
Next one, yes.
I knew you was about to call on me for this.
I'm just going in order. I'm just saying. You want
okay.
you want someone else to answer this one?
Nope, I want to do it.
Okay.
Albert, age 15, frequently steals from stores, smokes marijuana, initiates physical fights with peers. Hold on, let me move my thing. Sorry. And was convicted twice for vandalizing a neighbor's property. He also frequently argues with his parents and has threatened one of his teachers. Albert has been in and out of juvenile hall and is currently on probation. The most likely diagnosis for Albert is which of the following? So Albert is a teenager, adolescent. He is pretty much out of control. He's stealing, he's smoking, he's fighting, he's disrespecting and vandalizing. He's been in juvenile and he's on probation for some of these behaviors. So we want to know what's the most likely diagnosis for Albert. And we have A, conduct disorder, B, oppositional defiant disorder, C, adolescent antisocial behavior, D, substance use disorder.
Can I rule out? What can I rule out for sure?
I would rule out D, substance use disorder. Well,
okay.
Yeah.
Okay.
So
I'm going to rule out C because there's no such thing.
That's what I was about to say.
Okay. I can.
Crazy.
Okay. But I really can diagnose. I can diagnose on my LC especially. I can diagnose borderline as well as antisocial at 16. I really can. So I very rarely see those questions, but truth is you can. The other personality disorders we don't diagnose until we're 18. But conduct disorders from 6 to 16. And then, so untreated past 16, they really can be diagnosed with antisocial. But that's a very rare, and if that have to be like the only choice there for that to be better, the right answer, okay? Yeah, remember, my antisocials are my adult serial killers. They're not asocial. Asocial are people that don't like people. Antisocials are anti-society rules. They're very nice. They're so friendly. Remember, what was his name? Oh gosh, the guy in the attractive guy in Florida, blonde hair. No, not Dahmer.
Ted Bundy.
Ted Bundy. He was handsome, right? He said, "Can you help me find my little doggy?" And then he put you in the van and beat you to death and then kill you. But you know, he was nice. So my antisocials are not asocial, they're anti-society rules. They have no remorse. My pedophiles that say that she was 6 and she was sexy, it's her fault. That's antisocial. I don't have any remorse of what I did. So now between A and B, and I'm going to define these two. What's the difference?
Oppositional defiant disorder is more when you are kind of defiant toward authority figures and you're just defiant, like you're just going against what like I don't want to do that. I'm making up the rules. I don't have to listen to you, type deal. What I am a little confused about is
What's the difference between the two?
what I know about conduct disorder. I remember you saying it. You can correct me if I'm wrong.
I will.
Okay. I thought I remember something along the line of like when they have conduct disorder, they kind of grow up to be your antisocials.
They do.
Okay. So
There's something else though, what I'm looking for. Anybody else help her out? What makes them stand out on the test?
like they're harming animals and stuff like that. Conduct disorder.
And breaking
And
the
they
law.
run into it with the law.
Breaking the law.
Breaking the law.
Breaking the law. That's the key difference on the test.
Okay.
They've broken the law. Now go back to the question. So how do I know in this question which one it is?
In the question, I know which one it is because he has been in and out of juvenile and he's currently on probation. So that would
Been convicted twice for vandalism and all that other stuff. So that gives me a big old red flag that he is a conduct. So that's what you're looking for on the test, okay? I promise you, they are not trying to make it harder. They're not. And I know the test seems hard, but they're not. They're giving you hints and clues in the question. Go back to the question. Back to the question. I have to know the content. I have to know it. But they're giving you the hints all day, every day. That's the only way the test is fair because everybody gets the same material. Okay? Okie dokie. Miss Clark, I think I'm back to you, Shawana. Jessica, did I skip you? Let's go back to Jessica first. I apologize.
Elizabeth, who has been diagnosed with specific phobia related to driving on interstate comes to therapy after recently taking a wrong turn on a ramp that caused her to have to get on an interstate for a few minutes before finding an exit ramp. She also mentions that she has a recent change in her anti-anxiety medications. As Elizabeth begins to tell her story of her experience, she complains of a tightened chest and difficulty breathing. She insists on her therapist calling 911. After medics assess her during the therapy session, they determined that she had a panic attack, which likely induced the panic attack.
Okay, stand my question first.
Okay. So Elizabeth has a specific phobia related to driving. In this case, she comes to therapy after she got on a interstate and after a wrong turn and begins to have a panic attack while she's there. Mentioned she had a recent change in her anti-anxiety medication. She starts to tell the story about how she got on the ramp and how she became very had anxiety, and now she is wanting to call 911, feeling like she's about to have a heart attack in your session. Medics come there, they say her vitals are fine, likely she had a panic attack. What do we think caused her to have these feelings, these somatic feelings, I guess?
Okay. This is not a test question, but I always think it's fun to share with you those words for the phobias.
Mm-hmm. Okay. A medication change. B, being in therapy. C, anxiety from reliving her experience. D, fear of reoccurrence. I want to rule out medication change.
Okay. Is something in the question that says that?
Well, she said in the recent change of her anxiety medication.
Okay.
I'm going to rule out being in therapy.
Now we're between C and D. We're going back to the question. I'm going to ask you what words. Prove it to me in the question. I'm always going to ask you to prove it to me.
I believe the answer is C, and the only reason that I'm coming to that is because Elizabeth begins to tell the story of her experience. And while she's retelling that story is when she starts to experience the symptoms of a tight chest and difficulty breathing.
Absolutely. So anxiety from reliving her experience. Very, very good. Panic attack and panic disorder. Can we tell me the difference when it comes to diagnosing those two? Anybody know?
Well, a panic attack could that potentially happen to everyone, but I think that it would be prolonged would cause it to be the disorder.
Mm. A panic attack is having one. Well, no, having a panic attack is one. If you've not ever had one, be thankful. You think you're dying. You really think you're dying. Your heart is racing. You're calling 911 because it really feels like you're dying. You get there and they run all these EKGs and there's nothing wrong with you whatsoever. Nothing physically wrong, but your heart is still racing. The panic disorders, I've had one panic attack and then the question will say I slept in the hospital parking lot for 30 days because I was so sure I was going to have another one. It really feels like you're dying. My life fell apart about 10 years ago, and I'd never had one before, and you really think you're dying. It feels like you're dying. And for the couple of days after, my chest hurts because my heart is it's really pounded against my chest wall, the cavity. It hurts. You think you're dying. Okay.
I had one. I actually had panic attack disorder, and it feels like it's like your heart's about to explode.
Mm-hmm. Mm-hmm. When I stopped calling now, and I haven't had one in a long time, thank you, Lord. I can feel when my anxiety is starting to get bad, and I got a PRN for Xanax. We pop one, it doesn't get there. We're good. But especially when you're a mental health provider, you know it's here, but here you're thinking it's not real. It's not real. It's not real. My Apple Watch has woken me up in the middle of the night because my heart is accelerating and it's beating, and my Apple Watch wakes me up in a panic, like they think you're dying. And you can't keep going to the emergency room because you're the therapist. You can't be crazy, at least in public. So. You gotta hide your crazy in public.
I work in a psychiatric unit, so I hide my crazy.
So, and again, my ADD medication wears off, guys. I took it this morning I started at 9. So usually it's long lasting. I only took a half today. So you probably get to about 7. I take Vyvanse. I'm always very transparent. I'm always going to out me before anybody ever outs me. You'll know who I am. I'm real. I'm real. I'm real. I am very thankful for who I am. I'm very thankful for my business, but I'm very real. I'm always very real. So I'm never going to pretend like I'm anything that I'm not. But yeah, I'm attention deficit. Most of the women that I know are, and you just don't recognize it. We did not get diagnosed as children because we didn't get in trouble. We were sitting at the window going, oh, Pam and Bobby sitting in a tree, KISSING. But we didn't get in trouble. ADD people were smart. We're auditory processors. God, we're so smart. If you were a little dumber, you wouldn't know me, right? Because you'd know how to study and you'd never be in my class. The problem is you all have high IQs, right? And ADD is also you process things very quickly. But I say that to say, yeah, I got to sleep at night till my medication wears off. I work all day long. And y'all want me to take medication during the day. I was great at like 10, 11, 12, 1, 2, 3. I was great. But now you get what's left. So, okay. So let's keep going. Going back to you, Shawana.
Okay. Before I go to this question, thank you for saying that because I am 53 and I am thinking about getting tested for ADHD because I've taken this test. This will be my 4th time. And the last time I had such a really bad anxiety attack. And the problem for me, I realized, is just sitting there for 3 or 4 hours, however long this test is, just sitting there taking that test for so long. So now,
I'm going to say to you that I would suggest that you ask for more time. And I know you're thinking, Doc, the last thing I need is more time, but that's not true. What I want you to do is to not try to sit there for 3 to 4 hours straight. I want you to do 20 questions and get up and walk around and breathe. Do another 20 questions, get up, walk around and breathe. If you get the 2 extra hours in the private room, the clock won't stop, but you have extra time. And what I really find is what's hard is trying to power through. But I can, if I got, Pam, you got to stick to 25, just get to 25 and you can get up. And that's what I'm going to recommend, because if you, again, for accommodations, it has to be signed by your doctor, your therapist, or your friend who's a therapist. But I'm a huge fan, 2 extra hours, a private room. Remember, the clock won't stop. You still only get the break in the beginning, but in that room, I can just get up and stretch, or I can, do whatever I need to do and sit down again and keep going. I've had people, if you watch my videos, especially my NCE videos, I've had people who've had double time. You get 8 hours. One of my clients brought in a smorgasbord. She brought in breakfast, lunch, and dinner. As long as it's written in the accommodations, it's fine. She had grapes. She was having protein. She was whatever. One of my recent clients, what I thought was really cool, is part of her accommodations for anxiety, she was allowed to bring in pictures of her family. She made a little board that she brought in, and it just had like her children and some other words. I usually say when you first get there on your dry erase board, you can write something, right? Write a whatever. What she decided to do was to make this board, right, that she brought in with her. She put it in her accommodations, and that's what she brought in. That was her way to deal with her anxiety, knowing that she was taking this test for these people. So don't be afraid to ask for accommodations. They're never, ever going to say no. They're going to say, prove it to me. Test anxiety is not real. Generalized anxiety, that gets worse when you're studying for the test, is real. Okay. Generalized anxiety, GAD, free floating. You got anxiety all the damn time, right? You do. But now test makes it worse. So the days before the test, you can't sleep. You're tossing, you're turning, you're doubting. All those thoughts are running through your mind. That's what that's like. Again, I'm a fan of drugs. If you live in a legal marijuana state and it works for you, I don't live in one and that don't work for me. Okay, just so you know. But whatever works for you, do it. But you don't do it the day of the test. You try it before. You learn how to really reduce your anxiety, because you cannot perform at your peak. Those are just facts. One of the things that we learned at the Olympics, what's my cute little girl's name that did the gymnastics? What's her name?
Gabrielle.
She's older. She came back. That's Simone Biles?
yes,
Simone.
Yeah. And she stopped, right? She said she stopped for that. She took 1 year off because she said she couldn't. Wasn't she the spokesperson for like one of those online therapy programs for a bit? And one of the things is she said she couldn't perform because it was anxiety. She just couldn't do it. And it's real. It's real with athletes. It's real with everybody. Anxiety will kick your butt. And we can't not perform at our peak if anxiety is kicking my butt. Those are just facts. Okay. And I say that to you, not only for you, but for your clients, right? You're going to get this sheet of paper. You are, and you're going to continue seeing clients. You're going to make lots of money, and you're going to change the world. And I want you to remember, for your future clients, anxiety is real. Ask for the accommodations. It's okay. It's really okay. Nobody's ever going to know. I promise. Okay, let's keep going. So I'm still with you. Go ahead.
Your new therapy client tells you that he is having trouble with his boss at work and asks what you think he should do about it. As a practitioner of person-centered therapy, you would do which of the following?
I got to stay there, okay? Person-centered therapy is who? On both tests.
Person-centered.
Somebody help her out.
Carl Rogers.
Carl Rogers. Carl Rogers didn't say a damn thing. He smiled and nodded. He said, if I create this wonderful environment that's warm and fuzzy, I give you unconditional positive regard, I give you empathy, and he used genuine. That means congruent. What's coming out of my mouth matches my body. If I do all of those things, the client is going to figure it out by themselves. They can talk and talk and talk and talk, and they'll get it. Okay. Think Mr. Rogers' Neighborhood. And I promise you, this is on every, maybe not my BSW test. So you might see person-centered, you might see client-centered. And I promise you, what most of my social workers think is, they put the person's important, but don't get. It's a theory. It's a theory. This is Carl Rogers. Client-centered, person-centered. The client is the expert in their life. He came after Freud because Freud came in and he said, you dumb woman, let me tell you what to do. And Carl Rogers said, no, 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 no. The client is the expert. It's their life. If I create this amazing environment, they'll figure it out by themselves. Always, always, always LM and LC. I promise you, Carl Rogers is huge. Always. And you do it all the time. You just don't own it. You just don't recognize that you do it. Okay. So now let's read all four.
So well, you would do which of the following? A, lead with probing questions. B, focus on here and now. C, link current to past behavior. D, let the client arrive at their own decisions and insights.
So we're going to go through all, we're going to rule out. What would I not do?
C, for sure, link current to past behavior.
Do you know who that would be? Anybody? What therapist would do that? Usually a behaviorist. A behaviorist says past behavior is the best indicator of future behavior, right? So that's probably just a strict behaviorist. What about B? Who would say that?
Focus on here and now.
Come on, my LCs. This is on the test always. That empty chair, you're in an unfinished business.
Gestalt.
Gestalt. Absolutely. The word gestalt means to be a whole. It's Fritz Perls, but that's the empty chair. You cannot live in the here and now unless you get rid of the unfinished business. Okay. So now you're between A and D. You're person-centered. The client says, I'm having trouble with my boss, and what should I do? What would Carl Rogers say?
D, let the client have their own decisions and insight.
Ding, ding, ding. Absolutely. I may use reflection. What is that? Anybody? That's one of those active listening skills. What's reflection? Oh, come on. Reflection is the feelings words the client didn't say. You do it all the time. Remember, a lot of our clients don't have the verbiage just for feelings. They just don't have the words. You're working with a kid and he comes in and he throws the chair and he's like, the teacher doesn't like me, blah, blah, blah. And you say, could you just be upset because you got in trouble because you didn't do your homework today? I'm giving the feelings words the client doesn't have. Reflection is one of those active listening skills. always, always on the test. Okay. How we doing? Am I saying some things that maybe we have gone over before? We've heard them before. Dr. Pam, you just made it up yesterday.
You're doing good.
You got to guide me. You got to tell me. You have to tell me what you need. Let me keep going. I taught this last week. I'll stick with that one. Nope. Let me do this one. I taught this last week. If you watched my family videos last week, I'm gonna give it to you, Gloria, because were you here last week?
Yeah, I was here. I was here last week. Okay. We work in an employee assistance program, EAP, that provides brief counseling services to employees of several major companies in your area. Employees may be seen for counseling regardless of whether they have a mental disorder. Family member or coworkers are often included in treatment when it is appropriate and beneficial. Which approach to therapy would be most appropriate for the services you provide?
Tell me about the question first.
So I work for the employee assistance program, which just gives you a brief amount of sessions
Good.
to the employees for most major companies. And the employee may be seen for counseling regardless of whether they have a mental disorder. It's a place for them to talk with someone. The family members or coworkers are often included in treatment. So it's not just the employee, but even the family could call that service. So which approach to therapy would be most appropriate for the services you provide? So me as an EAP therapist, which would best fit this employee and the family and their family if they need it. Strategic therapy, psychoanalytic therapy, Milan systemic therapy, object relations therapy. Okay. I don't think it's going to be psychoanalytic because we'll need more time for psychoanalytic.
Got it. It's called psychodynamic now, but that's Freud, right? Where you're bringing all the things from the unconscious to the conscious. I don't have time for that.
Strategic is family. Let's leave that for a second. Honestly, I don't know what C is.
So systems theory, instead of saying Milan, I'm gonna say just systems theory.
Oh, okay.
If we do systems theory, we talk about like Brand van Bremer, how everything is related.
And I don't think it's D. I don't think it's object relations therapy.
Who's that?
That's Mailer.
Very good. And what does that theory say?
That's for attachment. If you have one person that's always there, you'll have a safe place to land.
Tell me more. Always there? What's her? She's got some time frame in there, doesn't she?
Yeah, is it
the first 3 years of life?
Yeah,
She said if you have this consistent caregiver the first 3 years of life, that you definitely will unconsciously bond, right? Have that relationship. But if you don't do that, she says that's where borderlines come from.
Right.
Okay. So now you're between A and B, and I'm going back to the question.
And between A and C, I think I would use more of a systems theory.
You would, you would. And
Mm.
no, I would not. I would use strategic. I apologize.
Oh,
So strategic is short and sweet. That's the reason for that.
that's
So
right,
if
'cause
I
it's time, it has a 6 to 12 weeks or something.
so and so can you give me some words that belong to strategic family therapy?
Generational,
Mm-mm.
oh no,
So
structure,
strategic is the problem is the way that you talk to each other. That's why,
communication,
yes, I'm going to see the double bind.
double
I'm going to
bind.
see first and second order changes. I'm
Mm-hmm.
going to see the paradox or the prescribing the symptom.
Okay.
Those terms sound familiar,
Yes.
guys?
Yeah.
Okay, so yes. So just in general, what they're asking you is do I know what that strategic family therapy? They're not tore up from the floor up like my structural family. They just need some strategies to get back to where they need to be.
Mm.
Let's try this one. Let's talk about little families here. Did everybody have at least two? Where am I going next? Anybody want to volunteer? I'm going to do a couple more. Who would like this one? Well, thanks, Demetria. You're, oh, Cassandra, I saw. Go ahead.
I'll do
Cassandra
it.
wanted.
Okay, good.
Go ahead.
Demetria, you could have went, girl.
She gonna get the next one. Don't worry.
Okay,
She
Go
good.
ahead.
She good.
I don't know what the answer is, but I'm gonna break it down. No, I'm Dr. Pam, you're gonna help me.
I am.
Which is not a pattern of negative emotional functioning according to transgenerational therapy.
Okay, I gotta stay in my question first.
Mhm.
What's it asking me?
What's not a pattern of negative emotional functioning?
Okay, so transgenerational therapy. Can you give me another word for that? That mean teacher made you go and ask your mom and daddy them some private stuff. Oh, that teacher made you do a genogram.
Oh, okay.
So transgenerational is the same as multi-generational.
Okay.
And that is going to be Bowen. Bowen, you go back 3 generations. And remember, when you're the genogram, you were looking for things that you pass down. When I teach this most often, I talk about the holidays because, we be doing the same thing every Christmas and every because, on New Year's Eve, how many of y'all eat some black-eyed peas on New Year's Day? Because you got some traditions you're supposed to. You can't stand it, but you ate a couple. None of y'all.
I said
Dang, y'all gonna have some bad luck because my peoples said.
eat grapes and the black eyed peas. I ain't getting it.
Hold on, so Gloria, you are Hispanic Latino.
Yeah.
What are some traditions that you passed down?
The 12 grapes, lentils. If you want to travel, you gotta grab your suitcase and go around around the block.
Okay, so African Americans believe that the first person in your house should be a man. Anybody ever heard that? Y'all mom and them didn't tell you that? It works, right?
I mean, I don't know. They say that, but we didn't have
Exactly.
a man. I didn't have a man come, but when my daddy was living, he definitely believed in that.
Okay, but again, so that's Bowen, that's the genogram. So when I think transgenerational, those are things we keep passing down. So this is verbiage that belongs to Bowen. And I always, again, if you all had to do a genogram, you might not have been honest with your teacher, you might have just got the A, but you were supposed to call up your peoples and find out some things that we keep passing down. And a lot of us do that. And especially the holidays are the most common. We do what we've always done. Okay. So then, and yes, I usually travel on New Year's Day. I also really like black eyed peas. I didn't think I liked them. I just, as an adult, realized my mama just opened the can and they're nasty. But if you make them from scratch, they're really good. You can okay. So which is not, first of all, which is not something that belongs to transgenerational therapy, and then which is not negative. Okay, so I'm going to give you the words, and if you didn't get, I'm pretty sure I thought family last week. Go back and you can watch a family video. You could just ask my staff to send you last week's video because I taught family therapy. Okay, and you've got to know these terms.
Okay.
Enmeshment belongs to structural. Enmeshment talks about not having clear boundaries, right? We're all enmeshed. I don't know where you began or I end. Emotional cutoff is a good thing. What he wants us to do is to stop doing the same things that mom and them have always done and not giving it any reason. Okay. Triangulation or what is triangulation? Anybody tell me? Somebody tell me.
That's like when I'm giving a real kind of of it, but it's me and my sister, and I'm adding in me and my mom. I'm adding my sister in it and bringing her into whatever the issue is.
What would that look like? Be real. Come on, because that's the goal. That's the goal. That's what I want you to do is take the stuff that we learn and put it in everyday life. I want you to go in on Monday and realize that you do this already. I just want you now you have the words for it because that's all you need for the test are the words. I don't make you a better social worker. I promise you. I'm going to increase your vocabulary because you're going to sound smart. But I don't make you a better social worker. That is good supervision and time. That's facts. Okay. You're already good social workers. You just need a sheet of paper.
Yeah.
Okay. So tell me what it may look like in your family. Between so who's close? You and your mama, you and your sister?
Me and my little sister are close.
Okay. So how does triangulation, what does it look like? What it looks like is when two people are fighting and they bring in a third person. Okay.
Yeah, so me and my big sister might be having a disagreement and bring my little sister in because me and her are closer now. She's in it. She's in the triangle of me and disagreement or argument.
Okay. We all do it. We all do it. I have a middle brother, and my brothers don't watch my videos, and I think he's crazy. Okay, I do. He's got some. He's already been a little paranoid, and it's getting worse. And I'll call my other brother. Did you talk to Greg recently? Am I talk to Greg? I think he's crazy, right? So when I talk to Greg, right? So I ain't gonna bring it up because it's bizarre, but I call somebody else in. So 3 people, that's triangulation. When you were growing up and your mom and daddy was fighting and even now, your mama says, tell your daddy. In therapy, when couples come in and they want you to pick a side, that's still triangulation. Yeah, you tell her she's wrong because if you pick a side, right, then you've stopped the fighting between the two. So I will tell you that B, C, and D all belong to Bowen. The only one that doesn't is A.
Okay. I was on the right path because that's the first one I was going to rule out.
Okay. Very good. Very good. Very good. Okay, guys, anything particular you want me to discuss that you want me to show what it looks like in a question that you're maybe not understanding?
Wait, hold on. So the answer is A is not a negative, not a
because it doesn't belong to Bowen.
Okay. Gotcha. Yeah.
All of these 3 things belong to Bowen.
But if it was just a Bowen, I'm just asking you this. If it was just Bowen,
No, all those. So if it was the one that's not good is C.
Right, triangulation. Yeah.
Got
C
it.
would be a
Because
good.
yes, that's the problem.
Okay.
But this particular question was just really making sure you knew which ones belonged to Bowen and which one didn't.
Okay.
And I think this is a typical question because there's no name in there at all, and you have to know that that's the genogram. This is a very typical test question. And again, if I'm wrong, if you've never seen anything like this before, just say, Dr. Pam, you make it up. What I know is when I interview my people that have passed the LC is the study material that they're using many times is not highly focused enough on the clinicians. Knowing the theories, knowing Gestalt is the empty chair, knowing that narrative is the story you tell in your head. And my LC is very high on that. My LM has got a couple, but Carl Rogers on both tests. You've got to know that Carl Rogers didn't say one word. Okay. So the techniques of psychoanalytic theory, you might see on your test psychodynamic because that's what we use now. Psychoanalytic is when I first started. You could lay on my cast for 3 to 5 years. It was great. I made a crap ton of money. HMOs came along and said, no, you only need 12 sessions. Okay, but it's still Freud. What's Freud's theory? How does Freud fix people? He says, remember, it's called the topography. The topography says that everything is in your unconscious and you don't remember. Right? He says, you poor dumb woman, you know nothing. Let me tell you what this means. He's the first one that ever did talk therapy. And what he said was that, let me show you. There we go. What he said is everything is unconscious. You don't remember what happened, and I'm going to tell you what everything means. So remember, Freud used the ink blot. The ink blot, that's like the whatever you see, and you would tell him what you see, and he would tell you what that really meant. He was the expert, and you knew nothing. Your id is your pleasure principle. Your superego is the angel, right? Always wants to be perfect, but they're unconscious. You really don't even recall. In your pre-conscious, those are things that you can figure out and remember by yourself. And the conscious, that very little part, right? Those are things that you can just go to your day-to-day life. But most of that you just don't remember. Okay. So a social worker that is coming from a psychodynamic or a Freudian viewpoint believes that everything is in the unconscious and I've got to bring it to the top. So now going back to my question, let's look at all 4. Okay. So I know I'm going to say either psychoanalytic or psychodynamic. It's the same. It's Freudian. So what are my goals? Gaining insight into the client's behavior, helping clients see how their thinking leads to certain emotional and behavior patterns, teaching people social skills such as assertive behavior, or helping people helping clients resolve their competitive strivings with their siblings. Anything I can rule out?
D.
Who would that be? What theory would do that?
Oh, I said D as in
Dog. Okay. Who, you gotta tell me who would do that then? Who's that?
Would that be family?
Birth order belongs to who?
Adler.
Adler. Adler is your birth order. Sometimes it says family constellation. I'm a firstborn. My stuff don't stink. Ooh, ooh, right? Okay. That is Adler. Whenever I see birth order, anything about siblings, family constellation, that's an Adler question. Okay. So D is out. What else is out?
B.
Tell me so what theorist talks about that?
I don't know. I mean, I feel like that's like a little bit on the CBT type of forum only.
Nope,
No?
nope, nope, nope. Did it say what changes the way you think? So it's just the behaviorist. It's just the behaviorist, okay?
I said B,
Skinner. I'm sorry, B, boy?
yeah, I said B, boy.
Okay, I apologize. So B is definitely CBT because B is a change in the way you think. You've got stinking thinking. D is a behaviorist. Whenever I see a question that says a behaviorist, all that matters is changing your behavior with rewards and consequences. They don't care how you feel. Whenever I see a behaviorist, all I want to do is change your behavior. So my answer is A. Whenever you see insight on the test, that's always Freud. Insight is unconscious. And I'm helping you understand what's in your unconscious because you poor dumb woman, you don't know. Okay. So as we learn, especially the interventions, this is the piece a lot of my clients are missing is knowing what theorists said what. Okay. If it said psychodynamic, if it said a Freud, the answer would still be the same. If it said, what do I do first as a psychodynamic? What matters is knowing that theory. My treatment plans, right, are based on what theoretical orientation I use. And they're not clear. The exam doesn't always say Skinner, but a behaviorist, I know I don't care how you think or how you feel. I'm going to treat you with rewards and consequences. A token economy is a question you might see lots of times. What's a token economy? And y'all got kids or work in any kind of behavior program, you have used the token economy. What
Like
is it?
Positive reward for like behavior.
Okay. And what is the goal of that?
You're enforcing good behavior with the reward.
Okay, I am, but it's a bigger picture because I am teaching you delayed gratification. I gave you a sticker or a pat on the back, but you got to have 5 stickers to get something at the end of the week. Right? So a token economy only reinforces your behavior right now, but it also is real life, right? I showed up for work today, but damn, I don't get paid till Friday. So that's what that means, right? I'm going to reinforce your behavior now, but at the end of the end of the token economy, the goal is teaching you that the reward comes later, delayed gratification. Okay. So those are the kind of things that I think a lot of my clients are missing, especially understanding the theories. And these were the treatment theories. I didn't do helping relations. That is the Piaget, schema, accommodation, assimilation. Those are the terms also. Again, just knowing the theorists. And tell me that I'm wrong or tell me what you need from me because I definitely, again, all the information I have is from my clients.
I think how we go through everything and then how you're saying like, okay, D, that's Adler. I think what I was struggling with, while testing and different things is not knowing what belongs to what theory. So not knowing, oh, that's their theory and different things like that, but breaking it down like that to be able to understand what something belongs to in a theorist instead of just kind of trying to memorize the theorist, understand what the theory is helps. Because I think you can just go psychoanalytic, like, oh, that's Freud, and then you can just go to, but you really have to understand, like, okay, what are the other theories and different things meaning, so that you can break that down before you just prematurely make an answer.
Absolutely. And we have to understand the theory behind the question. Let me show you this one. I think this is probably from a past test. A lot of you have probably seen this question. Let's look at this one. I am never going to pretend this test is hard. The LM and the LC are hard. They're hard. They're hard. I'm not going to lie. But it's a matter of really putting all the pieces together of knowing the theorists, knowing there's 24% of human development. That means normal human development, that it's okay, that the test says the babies should be potty trained until they're 3. Do you know that? My mama said 2, but that is not the right test answer. The right test answer is 3. And we don't diagnose enuresis, P, until you're 5. That means that the doctor has ruled out all the medical things and there's something else wrong. 5. And caprices is 4. That boy better not be peeing on himself at 5, love, right? Okay, that was my people's. Okay, but you gotta let go of that and understand what the test says. Look at this one. A mother meets the social worker due to concerns with her 7-year-old son. The mother reports the family recently survived an earthquake that destroyed their house and surrounding areas. She's worried that about her son because anytime he hears a loud noise, he starts to cry inconsolably and won't leave her side. According to a behavior therapy, what is this? So every time he hears a noise, he cries, but they survived an earthquake that destroyed their house. Okay, what theory is this? Extinction, negative reinforcement, operant conditioning, or classical conditioning? Anybody know? Do you want to say something?
We can rule out A and B.
Okay. Do you know what A means before we rule it out?
I'm not sure.
This is what I'm going to say, okay? The dinosaurs went extinct because their food, their clothing, their food, the sun, whatever went away, right? When I was working for the school system, if they stopped paying me, I'm going to be extinct. Okay, if you remove my reinforcement, right? I'm going to be bye-bye. We got bye-bye. So extinction is removing the reinforcement. So if I stop reinforcing a behavior, it'll go away. Okay, I'm going to take out B as well. So now, do I know the difference between C and D?
I'm trying to get them. Let me think. Classical and operant. Okay, I'm trying to get them straight. I'm trying to remember. When I did my master's program, I did this with you, and I remember we was talking about pairing our phone with the ringing sound, and I'm trying to distinguish. I'm trying to remember between Skinner and Pablo. I think I got them mixed up in my brain. Shut up.
Okay, hold on. Somebody else, come on. Somebody got to know these.
No, I know Pavlov is the dog drooling.
Okay, so how does that work?
It's when he hits the bell, the dog drools. I think that's classical. Oh goodness, I can't remember.
It is when you pair two things together.
Yeah.
Okay, so this kid has paired that loud sound with an earthquake. So that's classical conditioning. Okay, when I normally teach this, I'll say, if your phone rings right now and it's work, you look at that number, what's the feeling that it evokes?
Anxiousness.
Despair.
You paired those two things together. You don't even know what they want. But you know, last time they called, the time before they called, they wanted something from you, right? So you paired those feelings together. That's classical. Operant is rewards and consequences. Remember, if we like the behavior, reward it. If we don't, we punish it. That is operant conditioning. And again, it may not be written this way, but this, I promise you, is almost always on every test that I've ever taught. Knowing the difference, that you pair two things together. You might also see unconditioned and conditioned. So before the earthquake happened, the boy probably heard noises all the time, but it didn't mean anything to him. The stimulus was the noise, and the feeling was fear. He heard noises, but he didn't pair those two things together. But after the earthquake, now he paired the things together. So it's a conditioned stimuli, the noise, and the conditioned response is how my body reacts. That's classical conditioning. We pair two things together. We do it all the time. We do it all the time in life. We do. We just got to remember the verbiage. Okay, guys, I got to let you go. Did you learn some?
Yes.
Yes. When do we get the recording so that we can watch it again and take notes?
You think my staff's going to be working tonight?
No, but I'm thinking we
Okay,
get
then. So just so we know, okay, just so we clear, okay. And I do have weekend staff, but I'm pretty sure they doing their own stuff. I can't afford to pay them this time of night. So I'll put the questions in the chat box immediately. You'll get the and you can take it out before I hang up. The recording and the questions will probably come out. My staff is really good, so probably tomorrow.
Thank you.
So, but yes, they gonna work tonight. You funny. I ain't got enough money to pay them to work on a Saturday night, and especially tomorrow is a holiday.
Thank you.
Oh, sorry. And I think they're I'm pretty sure they're not working tomorrow, but they'll send it out anyway, even on a holiday. So, okay. Any feedback? Anything you want to ask me? Anything you want to get of how we answered the questions? We talked about both the social work problem solving method, right? First, everything's always a first question, and we really talked about then how to understand the question when it's a recall of going back to the question and knowing the content. We good?
Thank you, Dr. Pam.
Okay. It's my pleasure always. Let's get this sheet of paper and make lots of money. Come on. Bye.
Thank you. Bye-bye.